anytime you understand warning signs to predict what's going to happen to your body before it happens is a very valuable thing. There's a great book, one of my favorite books, called The Technology of War. It's by Sun Tzu. Having advanced knowledge so you can predict things. Now, this book, they're talking about advanced knowledge of an enemy coming, so you have knowledge about if you want to go to battle with them or not. But what I like to apply this to is your body. Having advanced knowledge of what's going on and reading different indicators of your body is so important. The problem in healthcare is when you go to the doctor and you have these clues or symptoms, whatever, they treat them directly. They don't use them to understand what's going on. But what if you were to use these indicators differently to help understand what the body really needs? So I'm going to go through 8 diseases and give you some of the warning signs that your body is trying to let you know there's a problem so you can do something and prevent this problem from occurring. So let's start with the first one, heart attack or cardiovascular disease. So the warning signs for that are usually chest pain, pain in your left jaw, pain in your left shoulder, or pain that goes down the left arm. Or maybe when you climb stairs or go anything up an incline, you don't feel right. Something feels off, whether it's you feel out of breath, dizzy. This could be the beginning of a heart attack. And one really good test to get is called the CAC test. This is a relatively quick test that can measure the calcification inside your arteries, which is a really good predictor of whether you're going to have a heart attack or not. One of the best things to take as a natural remedy is vitamin E in the form of tocotrienols. Another good remedy is vitamin K2 because that helps remove calcium in the arteries. And of course, radically change your diet. All right, number 2, stroke. Some of the early warning signs of a stroke or that you're getting a stroke could be anything on one side of your body being a problem. Let's say you smile and the left side of your face just doesn't quite move, or you raise both of your arms up and one arm doesn't go up. Those are classic examples that you could be having a stroke. Another one is your speech is slurred. So when you have a stroke, there's always this short period of time where you can do something about it quickly, and they can give you a certain medication that thins the blood to get rid of the clotting, because the problem with a stroke is a lack of oxygen in a certain part of your brain is called hypoxia. And the longer that your brain goes without oxygen, the more damage that can occur. So the best thing to do is to go to the emergency room and get that checked out. All right, number 3, an infection. Some of the early warning signs would be like a little tickle in your throat, this irritating cough that won't go away, or maybe it's you're excessively sneezing, or you might have a runny nose. All of these can be indicators that your body is coming down with something. The most important thing to do would be to take vitamin D3 in large amounts. I'm talking about 50,000 IUs. Adding some zinc and vitamin C would also be helpful. If you have any echinacea around, that's another good one. And then also just to stay really hot and warm to the point where you're sweating. So if you can generate a fever, that can actually quickly kill it off. Versus what a lot of people do is they'll take some medication to suppress the fever, which is the very thing that's going to help you overcome the virus. In fact, when people take aspirin to cut the fever down, now the duration of the infection is longer. All right, number 4, fatty liver disease. One of the warning signs for that would be like a full feeling or maybe even a tender or tightness underneath the right rib cage. That sometimes refers to the right shoulder, this trap, this muscle right here, or it could even go back into the rhomboid. All of that is more liver, gallbladder, kind of swollen, could be a fatty liver. But one of the big indications of a fatty liver is that your stomach is protruding. You have belly fat. The extra is spilling off into and around the organs in your midsection in the lower part of your body. Other symptoms of fatty liver could be itchy skin. The solution for that is to go on a low-carb, healthy ketogenic diet with intermittent fasting, and you're going to have to definitely avoid alcohol, eating frequently like snacks, and you may even want to take some choline, which actually can help strip off fat from the liver. All right, number 5, gallstones. Some of the warning signs for a gallstone would be your urine is darker, your stool floats, your stool is light colored, or you might have constipation. All of those items that I mentioned are a symptom of low bile salts. Bile salts are made by the liver, stored in the gallbladder, and when you don't have enough bile, you start developing a super concentrated crystal form of cholesterol. If you had enough bile, it would dissolve all that cholesterol, but you don't. So now you get these cholesterol stones that are developing because you don't have enough bile. So the solution for this is to add more bile salts and then do that for a period of time. Next disease I want to talk about is kidney stones. One of the early warning signs of a kidney stone is a kind of a deep pain that is either on the left abdominal area or the right side, or it could be in the back part called flank pain, which is usually going to be like a dull, achy like pain on one side. There's this little tube between your kidney and then the bladder called a ureter, and a lot of times if the stone is stuck in there or right before that at the level of the kidney, that can back up pressure and you can feel pain, especially in the deeper part of your abdomen. So if you have this, what I would recommend is you start doing lemon juice, like at least 2 ounces with water. You can drink it down, fresh lemon or just lemon juice, because you need that citric acid to help it combine with the oxalates, which are the most common stone. Combine with that at least 2.5 liters of fluid a day, because that way you can prevent the supersaturation from happening. Another really good thing to take would be magnesium. I would take magnesium glycinate, and I would also avoid foods high in oxalates. Okay, that would be almonds and almond flour, chocolate, and spinach. All right, number 7, an ulcer. Now, what kind of early warning signs would be an ulcer? Well, there's not really any early warning signs, but there are signs, because most of the time it's asymptomatic. If you have an ulcer, you're going to have pain or burning pain in your stomach area. You'll feel better when you eat. Now, if you eat and you get stomach pain, usually that's not an ulcer, that's indigestion because you don't have enough stomach acid. And the remedy for that would be betaine hydrochloride. But if you have pain on an empty stomach and you have an ulcer, if you added betaine hydrochloride, which is an acid, that's going to make it worse, which then you'll know it's an acid, right? And the remedy for that would be wheatgrass juice powder with water, and then drink that down as a chlorophyll healing agent. Another good remedy would be zinc carnosine, whether you have an ulcer in the stomach or the small intestine. And then number 8, diabetes. Okay, what are some early warning signs of diabetes? It's very difficult for you to skip a meal without being really super hungry. You may be hangry, which is kind of a combination of hungry and angry, irritated when you don't eat, and then you feel better or you're nicer to be around when you eat. You may also crave carbs. You may need a nap after you eat. You may also have puffy eyelids. You might have worsened vision, and even start to have this urinary frequency thing where you start to urinate more and you're more thirsty. And it just blows my mind what the medical profession does for diabetes. I mean, they give you a medication to lower your blood sugar, but they don't change your diet. You need to get off carbs. You need to go low carb, and you don't want to be eating all these snacks. We want to do intermittent fasting and the healthy version of the ketogenic diet. Now, I've done a lot of videos on how to use various clues to figure things out. If you have not seen this video, I think you'll be very interested in it.